one thing I just read recently that kind of blew my mind. I never even thought of this, but all the different functions that our bodies do, our cells really don't have the energy to do all that. So these 37 trillion bacteria down there, I mean, they're basically doing a lot of these different functions that they're using their own energy source there. So our cells really don't have to do a lot of that work. It's just really fascinating. In fact, there's a really good book for your viewers. It's called Fiber Fueled by Dr. Will Bulsiewicz. I mean, it's a New York bestseller. It is an incredible book. He has an Instagram site. I think it's called Real Gut Health MD. But it's really well written. It's he's kind of does it in a humorous way, but he has fact after fact that are mind blowing in there. I mean, it really is a fascinating book, and he does promote more of a whole food plant based diet, and so that's kind of the last precept is get that fiber intake up to at least 30 grams per day, preferably 60 grams per day. That's what I would strongly recommend. But that does have to be done slowly. One thing you can't do with patients is just say, okay, start eating whole food plant-based like I did. Because some people can't handle it because their gut bacteria really needs to make a major adjustment. So I usually tell people, hey, first week, why don't you do, steel cut oats with some berries, soy milk, and maybe try, just doing breakfast for a week or two. And then maybe the week after that, maybe do a couple lunches, learn recipes. I give all of my patients probably about 12 different really awesome cookbooks, websites that they can kind of learn different recipes and so forth. And then eventually, if you can get up to, anywhere from 85 to 95%, plant-based, that's fine with me. I don't have a problem with people eating meat. But I really do think they should try to keep their meat intake probably to about 15%, kind of the way the blue zone areas do, because they have a proven record. Those cultures been around forever. And sometimes people say, well, they're different cultures. Loma Linda is right in the middle of California. So, and in Loma Linda, they're basically where the Seventh-day Adventists eat. They're vegetarians. Women live about 10 years longer than their American counterparts, and men live about 14 years longer than their American counterparts. So, so eating a more plant-based diet definitely has extremely positive effects on longevity and health span.
When you look at it, when you take a step back and you look at cancer, of course, we should be approaching it a much more holistic way. And that's the kind of, gist of what you're saying here for all of this. Is that between diet, supplements, exercise, stress, sleep, the microbiome, these are things that are often overlooked, unfortunately, within the field of oncology. And I think it's just a little bit short-sighted to say we don't need to look at that and simply stick to the drugs. So I really appreciate even bringing this stuff up in a field that really kind of overlooks it.